So because Premier Pharmacy is not just a pharmacy, it's a wellness center. What's some of the things that you offer to the community at your wellness center?
Yeah, so I mean, it's really so just like a little background about that whole wellness center component. Like, when you look at our logos, you see the two P's, which stands for Premier Pharmacy. It wasn't until I was doing the articles of incorporation decided to add in wellness center to the name. And I added in wellness center because I wanted us to be more than a pharmacy, more than just your traditional dispensing, pharmacy. But I want us to be able to offer more services, to be more clinical focused, because of course that's what like we're taught in school now. The role of pharmacists are becoming more like involved, more clinical focused. Even insurance companies are soliciting pharmacists to provide more services and everything. So I wanted to create a space that would allow us to provide more clinical services. So we were doing at first like educational classes, like diabetes training, some point of care testing and different things like that. But after that, I decided that I didn't want to just only do like, those kind of services, but I wanted to involve other providers. And so that's where it came up, where I decided to involve a nurse practitioner. And so we not only do like things from a pharmacist perspective, but we actually have like a walk-in clinic setting that's ran by a nurse practitioner. And that nurse practitioner, now we're able to do physicals, we're able to do like be primary care physicians for some of patients, especially patients at first who were uninsured. Because of our price points, we're able to meet their needs. And then, so now we've expanded and we've been able to accept insurances in the clinic side as well. So yeah, we pretty much offer a lot of stuff, laboratory testing as well. We're very involved.
Oh, that's great. All encompassing. So when someone come there, they can be seen by the doctor, take that prescription and walk straight to the counter, which is a couple steps over, and get it filled. And you guys know what's going on with that patient from beginning to end.
Mm-hmm. Yeah, absolutely. And like one of the things that how I knew that there was room in the market for independent pharmacy still was basically because a lot of people don't realize that whether you are an independent pharmacy or part of a chain drugstore, you two are y'all direct competitors. And what I realized was how many prescriptions were actually written in the US, and then how many prescriptions actually got filled. And so there was a huge gap between the number of prescriptions that were written and the number of prescriptions that were filled. And so when looking at that number, you have to wonder to yourself, like, why did those prescriptions not get filled? And a lot of times it was due to the lack of education, due to the lack of insurance, or due to the lack of the individual being able to afford it. And so now you have an individual who probably went to the ER, they racked up an emergency room visit bill because they don't have insurance, and then only not to get the prescription filled that they really need in order to get better. So what we did was we were fixing problems. We are allowing individuals to come to our, minute clinic if it's something that's non-emergent, because of course a lot of individuals don't really understand the difference between going to the emergency room and your urgent care. So these situations were non-emergent. They can come there, pay $65 for a visit versus being billed for thousands of dollars, the way that the healthcare system bills. And then on top of that, being able to have that actual conversation with the patient to understand the factors that may, dictate if they're going to get treatment or not. Like, well, I know this drug may be better for me. However, I can't afford that. So let me get something that is, in the same realm or same line of therapy, but may cost you, not as much. And of course, we know sometimes something is better than nothing. Or, you may have to deal with potential side effects, and we could work on how we can not have that happen, but at least you'll get better.
Yeah, yeah. And I work in the big box chain pharmacy now, and I see it all the time where patients come in and that they need the medication, but they don't have the funds for the medicine, or the copay is too high, or they don't have insurance. So, with you having your own pharmacy, you can always fix it like that, and like try to make a way for them to get it. Me working in my store, I either have to like find a discount card, or either call a doctor and be like, hey, this is out of the price range. Let's talk to the insurance. Let's find something in the lower tier to get them well.
Yeah, absolutely. And then the other thing too is like sometimes working in the big box drugstore, just due to the demand of the metrics that, you know, they want you to meet,
Yes.
it's really hard for you to even to have that phone conversation with the doctor because it's not easy to reach doctors all the time. You call them, sometimes you have to leave a voicemail and have to rely on them to call you back, but the patient is standing right there in front of you and they want to answer now. And so, you know, by having the provider and the pharmacist all in the same area, it allows for that instant communication, that instant ability for us to like get things fixed and the patient to walk away with the solution then versus like having to come back or having to start therapy later. So that's one of our things is like to decrease the interruption in therapy.